Hello, my name is Sierra Dowdy, and this is my response for the discussion post for Module 2 in Advanced Pathophysiology. Type 2 diabetes mellitus is a prevalent metabolic disorder. According to the Center for Disease Control and Prevention, roughly 2 in 5 Americans will develop this disease at some point in their life. So this really shows what a big impact this has on our entire nation. If my best friend with no medical experience found out that she was genetically predisposed to developing type 2 diabetes and thought it was just from eating sugary food, this would be my response to her. Whoa, hold on. First, if a genetic test said that you were predisposed to type 2 diabetes, it doesn't mean that there's a 100% chance that you're going to get it. What it means is that based on your genetic makeup, you have a higher risk to get it than the average person. Secondly, type 2 diabetes is influenced by many things, not just your sugar intake and your genetics alone. Other lifestyle factors like how much you exercise, your body weight, the stress you put on your body, if you smoke, and your overall eating habits all play a role. In simple terms, decreasing the risk of developing type 2 diabetes requires you to take care of yourself for your entire life. Oh, and also, although you said you avoid sugary foods, consider avoiding sugary drinks too. Sometimes we don't think about how much sugar is in pop or these fancy sodas that I know you like to get. These sources of sugar can add up quickly without us even realizing it. And if you're concerned about your genetic predisposition to diabetes, I'd recommend making an appointment with your primary care provider. They can help you obtain some lab work to screen for diabetes and establish a baseline blood glucose levels that you can trend for the years to come. You could get an A1C. That'll help show how well controlled your glucose levels have been over the last 2 to 3 months. And you can also get a fasting glucose that shows how good your body is at regulating your sugar levels when it's not actively trying to digest something that you might have just ate. Getting these tests can help you keep track of your blood sugar control over your lifetime. So it's a good way to kind of see where you're at and what you need to do to keep your health in line. Over time, the body may struggle to keep blood sugar levels normal, which is why these tests are so important to get regularly. So don't panic just yet. You're young and you still have time to establish healthy habits and be cognizant of your overall well-being.